Okay. Hearty good afternoon and welcome to the session on egg freezing. We are glad to have Dr. Malti Madhu among us today to help us understand the topic. Egg freezing is a method used to save women's ability to get pregnant in the future. Doctor will help you understand how egg freezing works, the potential risks, and whether this method of fertility preservation is right for you based on your needs and reproductive history. The doctor will take us through that and more in the session today. Doctor, you have the stage.
Namaskar. As already explained in brief, that what is the topic today? What is egg freezing? Egg freezing or mature oocyte cryopreservation is a procedure in which mature eggs are harvested from the ovaries, either of the ovaries, and then they are cryopreserved at sub-zero temperature. And then later on, the eggs can be thawed, they can be mixed with the sperms, and the resulting embryos can be transferred inside the uterus, and healthy pregnancy can result. So, when we should go for egg freezing, what are the indications? Basically, any young women in their late 20s or 30s who are not ready for pregnancy, and at the same time they are concerned that whether the aging can affect the quality of eggs, whether the aging can uh, have detrimental effect on their ovarian reserve, they can opt for the process of egg freezing or oocyte cryopreservation. Then there are some young patients who are diagnosed with cancer, like breast cancer or cancer of any other organs. So, in some of the cases, after surgery for cancer, radiotherapy or chemotherapy is needed. So, as we all know, that chemotherapy or radiation therapy can have detrimental effect on the oocyte quality and their number. They can adversely affect the fertility of women. So, such women, before starting their cancer treatment, they can opt for egg freezing. Then there are some families in which there is history of premature menopause. Premature menopause means that the woman has her menopause before the age of 40 years. So in those women, already the egg reserve is low. Also, some cases of ovarian endometriosis or ovarian tumor where the surgery is needed, there is concern about decreasing egg reserve. So, in those cases, these patients can opt for egg freezing. There are some genetic mutations like BRCA1 and BRCA2 in which there are more chances to have cancers of ovary, uterus, and breast cancer also. So, in some of these cases, prophylactic surgery of the ovary is indicated, means that the ovaries are removed. So, before going for prophylactic oophorectomy, these women can opt for oocyte cryopreservation. So, how can we go about oocyte cryopreservation? For oocyte cryopreservation, you need to visit a proper IVF center which specializes in this field and which has got the facility for oocyte freezing. So, what are the tests that are needed before oocyte cryopreservation? The baseline test that is needed is AMH or anti-Mullerian hormone. The anti-Mullerian hormone is a marker for our ovarian reserve. It can be done by a simple blood test and on any day of the periods. It is not related to the cycle. Then there are some other tests like thyroid status, then blood sugar levels, then infection screen. These are all done before we go about the process. And once we are done with that, we can go for the process of oocyte cryopreservation. A very important point is when is the right age to go for egg freezing. As we know that after the age of 35 or so, we have decline in the fertility, means both the eggs number and their quality is diminished with the age. So the right age is in 20s or early 30s. I have some patients in my clinic who come for egg freezing at the age of 40 years or more. So sometimes the oocyte, the egg reserve is so much diminished that even with the process of IVF, we do not get good quality or number of eggs. So the right age, I would say, is in late 20s and early 30s. Then, once you have decided for egg freezing, you met with the fertility specialist, you are done with the blood tests. Then, on the second or third day of cycle, again, hormonal blood test of FSH, LH, and E2 is done, and a baseline pelvic scan is done. And then, if everything is in normal range, then we can start the process of ovarian stimulation. Ovarian stimulation means administration of injections or drugs for growth of follicles in either ovaries. Then, usually, this process takes 8 to 10 days, and monitoring is done through periodic ultrasound examination, and also blood test is done to measure E2 level in the blood. E2 is a hormone that is produced by the growing follicles in the ovaries. So, after 8 to 10 days of continuous injections, when the eggs are ready for harvest, then final trigger injection is given. And egg pickup is scheduled after 34 to 36 hours of the final trigger injection. The process of oocyte retrieval or egg pickup is done under anesthesia, so it's not painful. It's a daycare procedure, it doesn't involve any sort of incision or so. The eggs are retrieved under ultrasound guidance with the help of very fine needle that is inserted into the ovaries, and then they are directed towards the follicle, and the follicular fluid is aspirated, and then that follicular fluid is handed over to the embryologist who screens the follicular fluid for the eggs. Then, as I said earlier, that this is a daycare procedure, the patient or the woman needs to be in the clinic. The process usually takes 10 to 15 minutes, but the woman is under observation for almost 2 hours after the procedure. Then she can go home. And usually, after next day's rest, means total 2 days rest, she can join her normal activities, whatever is there in her routine. She is prescribed with the painkiller tablets and antibiotics for a while, for 5 days. And she can expect mild cramping that is usually settled in 24 hours. Uh, then another question is that what are the risks or complications that can be associated with the process of egg freezing? The process of egg freezing involves the same risk as of IVF. So usually it is well tolerated by the women. Sometimes they, in some polycystic ovarian cases, there is risk of mild hyperstimulation. The risk of hyperstimulation is due to large number of eggs present in either ovaries in case of women with polycystic ovaries. Actually, when we start giving injections, that then sometimes all the resting eggs in the ovaries start growing simultaneously. So some of the women may have bloating of the abdomen, or very rarely collection of fluid around the ovaries. But to avoid hyperstimulation, measures are taken like the selection of drugs, then minimum effective dose is given, cycle is closely monitored, and also the trigger injection, different type of trigger injection is given for those patients who have the risk of ovarian hyperstimulation. So that is severe hyperstimulation is very rarely uh, occurring nowadays because of these change in protocols. Then, how much time is needed for egg freeze process of egg freezing? Almost 15 days in a cycle are needed, starting from second, third day of cycle, and then Within 15 days, the process can be completed. Then the most important process of freezing is done as we hand over the follicular fluid to the embryologist. The embryologist does screening of the fluid for the oocytes, and then mature oocytes are frozen at sub-zero temperature inside the liquid nitrogen. The eggs can be frozen for 5, 10, or 15 years. And On later occasion, when the woman is ready to get pregnant, then the eggs can be thawed, they can be mixed with the sperms, and then the resulting embryos can be transferred inside the uterus of the woman. So, what is the cost of egg freezing? That is also a common question that is asked by the patients. Usually, it involves the complete process of IVF, where except for the mixing of eggs with the sperm. So, the cost is around 1.5 lakhs to 2 lakhs, and it can be frozen for 5 years or 10 years or 15 years depending upon the patient's wish. And what are the benefits of egg freezing? Definitely, you can preserve your fertility whenever you in 30s or in late 20s you are not ready for pregnancy. You can preserve your eggs, freeze them, and then on later date whenever you are ready for pregnancy, you can use your own eggs for attaining pregnancy. The second thing is that the risk of miscarriage increases with the age in women, especially after the age of 35 years. So, if you have frozen your eggs at an earlier age, then there is no aging of eggs. So, uh, if you are getting pregnant with those eggs that you have preserved at earlier age, then the miscarriage rate due to genetic abnormality in the eggs uh, cannot happen. So I think this is all about the process of egg freezing. If you have got any questions regarding that, please feel free to ask. Then a very important indication for egg freezing is in women who are diagnosed with breast cancer or cancer of some other organ. In all those women who have not completed their families, young women, we can always counsel them for the process of egg freezing. They can freeze their eggs and complete their cancer treatment, and at later occasion, whenever they are ready for pregnancy, they can come and get their embryo transferred inside their uterus. I think there are no more questions. Thank you for your patient hearing.